Hi! Welcome to Grow with Amanda.
I like to tell guys I'm bi on the first date because it really turns them on. I let them figure out the polar part later.
This episode is going to be all about bipolar disorder. And before people dismiss it thinking, what do I need to know about bipolar disorder? I don't have it. I don't know anybody who has it. Let me stop you right there. 3% of the population is diagnosed with bipolar disorder. So I guarantee you there's somebody in your life, whether they tell you or they don't, that has bipolar disorder. And I think if you stick around, you might get a better understanding as to why these people behave the way they do, and perhaps maybe how you can help them. Bipolar disorder used to be called manic depressive disorder, and I believe that changed in like the 70s or the 80s. So bipolar disorder is a spectrum basically. It goes from extreme highs to extreme lows, and the extreme highs are known as a manic episode or hypomanic episode, and the lows are obviously a depressive episode. So what is a manic episode, you might ask? Well, let me kind of give you what some of the classic symptoms of a manic episode involve. So you have extremely high energy and you require like no sleep. I don't just mean like, oh, it's a good day, you have all this freaking energy, like you can just conquer the world today. No, I mean like you're going on a minimum of 5 days of constant energy with this like buzz inside of you where you feel like you constantly have to be doing something because there's this buzzing, and the buzzing can get so out of control that you genuinely feel like you want to rip your skin off. By me saying genuinely rip my skin off, like I genuinely tried to rip my skin off at times because it was so uncomfortable. And also with the lots of energy comes like no sleep. When I'm in my manic phases or even a hypomanic state, I get probably 1 to 3 hours a night, maybe if I'm lucky. Another symptom that's associated with a manic episode would be extremely fast thoughts. Now, everybody might experience fast thoughts here and there, and people with ADHD, for example, might experience them a lot more than somebody else. But when you're in a manic state and you have fast thoughts, I like to compare it to a busy highway. The amount of cars that go by on a busy highway like in Toronto or New York, that's how many thoughts go through your head in a moment. Like you have thousands of thoughts, and to catch on to that, like you genuinely have to try so hard, and that's where your concentration and your focus come in. When you're in a manic state, those things, out the door. It is so much harder to stay focused and to stay concentrated on one task when you're in a manic state because your mind is just all over the map. These thoughts are constantly coming, and like I said, to be able to grab onto one thought is really hard. Euphoria might also be a symptom of bipolar disorder, and if you don't know what euphoria is, it's basically an extreme happiness or an extreme sense of self-confidence. Now, everybody can experience euphoria and be extremely happy and feel super confident about themselves. But I want you guys to keep in mind when it comes to anything that I'm going to talk about is these are the extremes. So take being super confident and take it to the extreme where, for example, when I was in a manic state, I think I was 240 pounds at this point, which was my heaviest. And I genuinely thought that I was 100 pounds. I thought I looked like I was 100 pounds. I felt like I was 100 pounds. I had all this confidence in the world. Also, in a euphoric state, you might think that you can communicate with God. You might think that you are God. When you're in a manic episode, your senses are going to be heightened in the sense that things are going to smell better. If you don't like a certain smell of something, it's going to smell a hell of a lot worse. Things are going to taste better. Things are going to feel better. And I always try to explain it like when you touch a soft pillow, like it genuinely feels good, right? Well, I would sit there for hours on end just hugging a pillow and going like this up and down because the feeling was like out of this world. I can't describe it. I have tried to describe this feeling to people before, especially being in that moment, and there's no way you can describe it. Your senses are just heightened, so things feel amazing. That kind of plays into the whole sex drive. When you're in a manic state, your sex drive is going to be a lot higher, mostly because things feel better. So of course, sex is going to feel pretty freaking awesome. I know what people are probably thinking at this point. That doesn't sound that bad. Well, those are kind of the more positive aspects of being in a manic state. Now let me talk to you about like the drawbacks to being in a manic state. So your speech is very fast, so fast to the point that most of the time people can't understand you. I had so many times where people would have to ask me to repeat myself, to slow down, to enunciate what I was saying, and I try to talk as fast as I can when I'm in a state like this, like a stable spot, just to try to see if I can talk that fast, and genuinely I can't. I will stumble over my words, but when I'm in that manic state, I don't even have to think about it. It literally just flows out. Like, irritability and quick to anger is another one. I can tie this into fast speech, mostly because when people would tell me to slow down or to enunciate my words or to repeat myself, I would get so frustrated and so mad that half the time I would just walk away. I couldn't deal with it because I knew that I would lash out. And those times that I didn't walk away, I did lash out. And they would have no clue why I was lashing out at them because they were just asking a genuine question. And that's a normal thing to ask somebody. My reaction was not normal. It was very atypical. Risky behavior is something that is strongly linked with manic episodes. So by risky behavior, I don't just mean spending all your money, which is a huge thing. I maxed out 3 credit cards totaling almost $6,000 in a matter of like 3 weeks when I was manic. Another risky behavior would be unsafe sex or sex with strangers. Another one would be abusing drugs and alcohol. People who have bipolar disorder are 10 times more likely to abuse drugs and alcohol. When you're in a manic state, you can also experience psychotic symptoms, such as that there's absolutely nothing you can do in this world that would be wrong. Everything you do is right. You can feel like there are no such things as consequences for you, and that's kind of where the stealing comes in. Personally for me, I would steal because when I was in the manic state, I would feel like nobody could touch me. There's no way I would get caught. Along with psychotic symptoms, hallucinations and delusions kind of play a mix. Not everybody will experience these things, but it is something that if you are in a manic state, you should be aware of, because I genuinely thought that I didn't have to worry about this. I thought that, oh, I've never heard things, I've never seen things, that it's not going to happen for me. But here's the thing, you don't know that you are seeing something that's not there unless you clarify with other people. You don't know if you're hearing things that are not there unless you clarify with other people. I could have went 4 years hearing and seeing things that weren't there without realizing it. And the reason I kind of started to clarify with people is because I started to get super paranoid that people were following me, that everybody was out to get me. I was just extremely paranoid about everything. The main thing though that I really remember, and I can still feel this feeling inside of me sometimes, is the feeling that someone is following me. And that is so strong. And when that's paired with things like hearing things over your shoulder, like a person constantly breathing, that's going to trigger me hardcore. And it did trigger me. I was hospitalized a couple times because I couldn't stop hearing this person breathing over my shoulder. There was no one there. In order to be in a manic episode, you have to be experiencing some of these symptoms for a minimum of 5 days. Obviously, there's a lot more criteria you have to meet. But just to start you guys off on a basis, 5 days is what you need to experience some of these symptoms, if not all of these symptoms, for you to be classified in a manic episode. Hypomanic state is basically the same as a manic state, except it's a little bit less severe. People say it's a lot more manageable to deal with a hypomanic episode than it is to deal with a manic episode. I've experienced both. I definitely agree with that, but I don't agree with the fact that it is easy to deal with a hypomanic episode. It is still extremely hard, it's extremely debilitating, and you need to get help from a professional. Most people, when they're in a manic or a hypomanic state, they don't reach out, and that's where people go wrong, because you can actually harm more things when you're in a manic episode than when you're in a depressive episode. And I don't think people realize how bad it can get. When I was in a manic episode, I wasn't sleeping, and therefore, because I wasn't sleeping, obviously your mental health, whether you're healthy or not, is going to take a turn for the worst. I was extremely irritable. I was extremely quick to anger. I was also like the happiest person you could ever meet, and I know that sounds very contradicting, but it would be like I would be hanging out with somebody. Let's say we were painting something, everything was going great, and then all of a sudden I make a wrong move on my canvas and I lose it. I remember tossing my canvas across the room. I remember throwing paint everywhere. Now that I've talked to you guys a little bit about a manic episode and gave you a few examples as to what it might look like, we'll talk about the other side of the spectrum, a depressive episode. Now this isn't your garden type of depression. Remember, everything with a bipolar disorder is to the extreme. So take a depressive episode, times it by 10. That's what a manic depressive episode looks like. Some characteristics that might be involved is you're going to be extremely sluggish and extremely exhausted. You're going to have no energy, and you might even feel super restless. And I want to give an example of how bad things can get when I say that you have no energy, you have no motivation, you're super sluggish. When I was at one of my lowest points, this is hard for me to say because only a couple people know this about me. Oh boy, sharing's hard. So when I was at one of my lowest points, I didn't have the motivation to do anything. I didn't have the willpower to even get out of bed to go to the bathroom. And so I would go to the bathroom in my bed, and I would just sit in my own urine or lay in my own urine until either A, it was so uncomfortable that I had to change it, or B, somebody told me to change it because the smell was getting too bad. So that ties in with the whole super sadness, or a better word to describe that is despair. You generally are just in this super low spot and you feel like you can't get out of it. You feel like nothing will help, nobody can help you. Lack of interest in things that you enjoy is another sign of being in a depressive episode, because you don't give a crap about anything. Like I said, I have been hospitalized when I've been in a low. Most of the time that's when I am hospitalized, because along with all these other symptoms I said, suicidal thoughts, ideations, and attempts is classified as a symptom of a depressive episode. I will be there in the blink of an eye. I don't care what I'm doing. I will drop everything, because I would rather hear you tell me about your problems than hear about your obituary. And one thing that kind of gets me through some of the really dark times is when I'm feeling like I just want to end my life and I just want to be done with everything. I remember that this pain that I'm currently feeling, if I decide to take my life, I'm going to end up hurting those people around me that I don't want to hurt. And so that's why I have pictures everywhere. I have pictures all over the place. I even have a picture in my car on my front windshield, because I'm sure I'm not the only one out there who can relate to having some bad thoughts and then driving and then wanting to just, just kind of, and that's why I have it in my car, because I've had those thoughts a lot in my car driving. I don't want anybody, I don't care if you are the worst human in the world or the best human in the world. I don't want anybody to feel what I go through when I'm at my lowest. I don't want people to go through that, because it sucks. It's one of the hardest things I've ever had to deal with in my life. And unfortunately, I've dealt with it more than once. Another thing with a depressive episode is your appetite might change. So whether that be overeating or undereating. And of course, if you're going to overeat or undereat for a period of time, your weight is going to change. So you might gain weight or you might lose weight. Anything that would be in front of me, I would eat, because I was just trying to numb my feelings. And I was probably like 240 pounds at that point, because all I did was eat. And when I got out of that depressive episode, I lost 30 pounds right away, because I went back to my normal eating habits. I wasn't binging 24/7. So that might be something to keep an eye on. Even if you don't think that your appetite has changed or that your weight has changed, maybe check in with people around you. That's a big thing with bipolar disorder. You can't always trust your own instincts. You can't always trust yourself, because your brain could be lying to you. Bipolar doesn't just affect your mood. It affects your energy level, your judgments, your memory, your concentration, your appetite, your sleep patterns, your sex drive, your self-esteem. Literally every aspect of your life is impacted. And it also impacts your physical health. It's not just this mood altering disability. It literally surrounds your entire life, and if you don't take control of it, it will take control of you. I'm speaking from experience. It will control you and your life. So now that you guys understand the basis of what bipolar disorder is, there's the manic episodes or a hypomanic episode, and there's a depressive episode. So bipolar 1 is depressive episodes and manic episodes. Bipolar 2 is depressive episodes and hypomanic episodes. Now, that doesn't mean if you have bipolar 2 disorder, you can't have a manic episode. You 100% can be swung into a manic episode. But the majority of the time, you're going to have hypomanic episodes. Also, with bipolar 1, so that's manic and depressive episodes, you're going to really not have that much stable time in between. It's going to go from extreme low to extreme high, back to extreme low, back to extreme high. You might have a few stable spots in between, but it's kind of pretty rare. Bipolar 2, which is the hypomanic and the depressive episode, you're going to have a few more steady spots in the middle. There's also such thing as a mixed episode, which it's exactly what it sounds like. It's a mix between a hypomanic or a manic episode and a depressive episode. It doesn't have to happen in the same day. It can, mind you, but it can also happen within a few days of each other. I have experienced quite a few mixed episodes, and this is where I use the analogy of, am I going to wake up as Eeyore or am I going to wake up as Tigger? Who are you going to get today? Because when you're in that mixed episode, you truly don't know what you're going to get. And are you going to stay Eeyore all day, or are you going to switch to some Tigger for a bit? You really don't know. It's genuinely a roller coaster. So a mixed episode in one day might look something like you're super happy, you're super excited, you have this buzzing inside of you, but at the same time you're having suicidal ideation and suicidal thoughts. Finally, I want to talk about rapid cycling, because rapid cycling is, you have 4 cycles throughout a year. Everybody who has bipolar disorder will have a cycle. It's kind of really hard to tell what your cycle is unless you're tracking it and you're really paying attention. So for me, personally, what I've noticed is significant times of the year will trigger my manic episode or my depressive episode. Here are a couple facts about bipolar disorder that I think are pretty important. So bipolar disorder starts presenting itself between the ages of 15 and 25. So you can be 24 years old and have absolutely no symptoms, and then once you hit 25, it's like something happens and this switch just turns in your brain, and all of a sudden you have all these manic and depressive episodes. I contribute that to the fact that most of our brains don't start developing until we're 25 years old anyways. Just be mindful, pay attention to yourself. Something else that I found really alarming when I started doing a little bit more research about bipolar disorder is that 40% of people who have bipolar disorder cannot hold down a job. I don't want to be one of those statistics. I want to have a job. I have a passion for helping people, and so I want to eventually become a peer support worker. And I'm not going to let this disorder keep me from doing that. If anything, I'm going to allow this disorder to help me help others. I want to open up my life and let people see that they're not alone. That what they're going through is not some abnormal thing that no one has ever gone through. There are people out there that have gone through what you're going through. There are people out there to help. There are people there to listen. The thing is, you have to be willing to get the help. You have to be willing to look for that help. You have to be willing to want that help and want to make a difference in your life. Like I said before, people who have bipolar disorder are 10 times more likely to abuse drugs and alcohol. If you are somebody who has bipolar disorder, if you know somebody who has bipolar disorder and they are claiming that marijuana or alcohol or any other type of drug is helping them, they are in a state of delusion. It is not helping them. It's numbing them. If anything, it can also be making things a hell of a lot worse. I know that when I am in a depressive episode and if I smoke too much pot, I will send myself in the complete opposite direction. I will be from like hitting the floor all the way to touching the ceiling. Alcohol and drugs has a big influence on anybody, let alone somebody who has a mental health disorder like bipolar disorder. It is very, very mind altering. This is a stat that's really alarming. 25 to 50% of people who have bipolar disorder will attempt suicide in their life. And 15% of that 25 to 50% will succeed in their attempts. I owe a big thank you to everybody who's in my life and who has affected it in a positive way, especially when it comes to keeping me here on this earth breathing. Not just my friends and family, but also all the nurses, all the different types of doctors that have helped me, because if it wasn't for them helping me even in the times that I didn't want help, I wouldn't be here today. So what are some things that you can do if you have bipolar disorder and you want to get help? Well, first off, talk to a doctor. That's the very first thing. Talk to a doctor. Do not diagnose yourself off of videos like mine or other people's on YouTube or anywhere online. Do not diagnose yourself. Go see a professional. Now, once you see a doctor, there's going to be a few things that they're going to suggest. First off, it's going to be medication. If you have bipolar disorder, there's kind of a handful of meds that you can try. I was on 9 different types of medications at one point. I am now on 2. Make sure you're doing your own research when people are suggesting medications. Make sure you're keeping track of what medications you have tried and why they do not work for you, if they don't work for you. Because as much as this is all going to be in your file so that the doctors can access it, they're going to want you to tell you most of it, because most of the time they're not going to want to read your entire file over again to figure out what you've tried and what you haven't. It's just reality. They have a lot of patience. You need to take control of your recovery and not just let the doctors kind of do with you what they will, because then you're just going to be their lab rat. And let's face it, being a lab rat sucks. I've been a lab rat before. It sucks. Can I say that enough? It sucks. So the different types of medication. So there's lithium. 80% of people who have bipolar disorder are on lithium. They are not sure exactly why it works or how it works. All they know is that it works. There's also antipsychotics, mood stabilizers, benzodiazepines, and there's also antidepressants. This is my personal take on it. I have done lots of research about antidepressants and having bipolar disorder. Almost 99% of the articles that I have found have told me that if you have bipolar disorder, you should not be on an antidepressant. I have talked to my doctors, my psychiatrist, my psychologist, my family doctor. They all have different opinions. So basically, it's kind of what works for your body. I tried an antidepressant. I didn't think it worked. I got myself off of them. And now I'm simply on lithium and an anxiety med, which is a benzodiazepine. I have not met a single person who has tried a certain type of medication and found the one that works for them right away. It's always a trial and error basis, because unfortunately mental health is not a straight science. You are going to be a little bit of a guinea pig, but make sure that you are judging what you are the guinea pig on. If you do your research on a medication and you talk to your pharmacist and you don't like it, don't take it. Don't allow somebody like a psychiatrist or your family doctor to give you something that you are not comfortable with. Don't allow them to keep you on something that you are not comfortable with. This is your body. If you gain 80 pounds, which I did, from medication and you don't like that, you tell your doctor. There are different medications out there for you, and you don't have to suffer. You don't have to let one thing in your life drop in order to get your mental health up. So my self-esteem I was not allowing to continue to drop by continuing to gain all this weight on a certain type of medication. I got myself off of that. While we're on the top of a medication, I don't care what mental health disorder you have or what medication you are on, whether it's for mental health or anything else, please, 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 please do not take yourself off of your meds cold turkey unless you talk to a professional. And that's not just your pharmacist. You talk to whoever prescribed the medication to you. Because I went off of my antidepressant thinking, I don't want to be on this anymore. I've done my research. I know best. I'm getting myself off of it. Well, that was a really bad decision because I was on Effexor, which is one of the worst medications that you can come off of. I almost was having seizures. I was in full convulsions. It was not a pretty sight. I was hospitalized for I think a week and a half because the withdrawal symptoms were so bad. I was not aware of this when I took myself off of it. So please don't take yourself off any medications unless you have the approval and the supervision from a doctor. On top of medication, there's also therapies. I personally do not believe that you are going to become the healthiest version of yourself unless you incorporate the two things. And there are a lot of different therapies, so don't even try to tell me that you have tried them all. I won't believe you. I will stop you dead in your tracks. You have not tried all the therapies. I haven't even tried all the therapies. So some of the therapies that I have tried that I found that are very beneficial, especially for somebody who has bipolar disorder, is CBT, which is cognitive behavior therapy, DBT, which is dialogue behavior therapy. There's also family therapy, which honestly I've never tried family therapy. Group therapy, which I have tried. I'm totally for group therapy because I'm open to sharing in public with whoever, but some people aren't like that. So individual therapy might be the way for you to go. There's also things like social rhythm therapy and ECT. Now these are all very different types of therapies. I suggest you do your own research on them. I will have a video about each different type of therapy. I would recommend you do more research than what I tell you, because I can only give you a certain amount of information, and there's a lot of information out there for you to access. So I can just be one of those pieces of information. Please go do the rest of the research and get more information, as much as you possibly can get, so that you are as educated as you possibly can be. So I want to tell you guys a little bit about my journey and when I was diagnosed, who diagnosed me, and what I did right after I was diagnosed. So I was diagnosed when I was in grade 10, so that was 8 years ago, and I was diagnosed with depression and anxiety. 5 years later, I was diagnosed with bipolar disorder, and that was the correct diagnosis. Because when I was diagnosed with depression and anxiety, I still felt like something was missing. I didn't feel like that was a proper evaluation as to where I was, because everyone always told me, Amanda, you're either super high or super low. There's no in between with you. And I truly believe that. And so when I was officially diagnosed in 2018 with bipolar disorder, my instant reaction was, holy shit, finally! Like, genuinely, I was like, finally, something makes sense. Like, I'm not crazy. I am not crazy. What I'm going through is totally normal and explainable. And, like, that was the biggest relief that I could ever ask for, because not knowing what is going on in your own head and not having an explanation for it is really, really draining, because you're constantly analyzing everything in your brain and every action you do and everything you say. Once I finally got diagnosed properly, and the first time I was diagnosed in grade 10, I was diagnosed by my family doctor. When I was diagnosed in 2018, I was diagnosed by a psychiatrist. And I strongly recommend seeing a psychiatrist or a psychologist, because family doctors are great and everything, but they're not that educated on mental health unless it's something they're passionate about. That's just my personal take on it. There could be lots of family doctors. Your family doctor could even be great for you and your mental health. I just personally, and my current family doctor even suggests that I talk to my psychiatrist and my psychologist about all my mental health medications. After I was diagnosed, I was super relieved. We started trying me on different medications, and that's when I turned and I was like, you know what? I've been dealing with medications for the last 5 years. I don't want to deal with medication anymore. So I did some research on ECT, and that's going to be a whole other topic. I'm excited to share that with you guys because it kind of ties into my bipolar and my PTSD. If you feel like you want some more information or want a little bit more story time with me, just let me know. Leave it in the comments below, and I'm more than happy to do so. I just don't want to overwhelm people with too many stories and too much information all at once. So I hope you guys enjoyed, and if you did, hit that subscribe button, turn on your notifications, and get ready to grow with Amanda. I feel like I told enough about my life. Did I talk about me enough? I hope I did. I want to figure out, you're also, maybe if I put some wellness spray, some eucalyptus, tea tree, and rosemary, I will chill the fuck out. So don't count your coins before you have them all. I don't even know if that made sense. So I can't even talk. How do I put this? Man, putting things in like a more simple way is kind of complicated sometimes.